Alcohol in Pregnancy, a digital presentation by Dylan McWhinney. Staple to Australian culture, alcohol plays a significant role in social circumstances, celebrations and activities. Provided the broad cultural acceptance of alcohol use in our country, drinking during pregnancy is far from surprising, with at least 78%, which specifically indicates in every 3 or 4 women, alcohol is consumed monthly or less whilst being pregnant. Common among women aged 14 to 49, Australian women also record some of the highest rates of alcohol use during pregnancy in the world, standing at about approximately 35.6%. Pregnancy involves the state of carrying and developing an embryo or fetus within the female body. Risks are associated with alcohol consumption in pregnancy due to when crossing the placenta, nearly equal concentrations of alcohol are attained by the mother and the fetus. Exposing the fetus to alcohol poses significant threats and thus adverse effects. Implications include stillbirth, spontaneous abortion, premature birth, and intrauterine growth retardation, all of which collectively refer to fetal alcohol spectrum disorders. Interfering with the normal development and progression of the unborn fetus, fetal alcohol syndrome belongs to the FASD collective and is a major public health issue throughout Australia. Displayed in children who are exposed to high amounts of alcohol in the utero, FAS remains to be poorly diagnosed, chronic, and costly. Caused by excessive parental alcohol exposure, it consequently leads to diffuse acquired brain injury within children. Considered a whole-body disorder, affected children often demonstrate physical, behavioural, and learning problems, including abnormal facial characteristics, growth impairments, and abnormal function or structure of the central nervous system. The likelihood of chronic health problems further down the track is increased dramatically with those diagnosed with the syndrome. These include mental illness, drug and alcohol abuse, as well as disadvantages in social determinants. The prevalence of alcohol use during pregnancy is widely spread across Australia, which is becoming increasingly driven by social determinant factors including socioeconomic status and age. Socioeconomic status can influence alcohol consumption in pregnant women. A study conducted by Colin stated that people with a higher socioeconomic status may consume similar or greater amounts of alcohol compared to people with a lower SES. These are also in association with an individual's race, ethnicity, and age. Similarly, individuals who are unemployed are associated with a higher daily alcohol consumption average. In addition, pregnancy and binge drinking were linked to women with more than a high school education, with those choosing to become pregnant being less likely to consume alcohol whilst pregnant. This indicates as education increases, the association between binge drinking decreases. A female's age also influences alcohol use whilst pregnant. A study by Veloso and Monteiro examined the link between alcohol use and adolescent females. A questionnaire was given to 256 adolescents, with questions being based around pregnancy, alcohol consumption, and socioeconomic status. Results explained that there was a prevalence of 32.4% for alcohol use by adolescents teens during pregnancy, with 36.1% of those teens consuming a risky or excessive amount of alcohol. The study shows there is a high prevalence of alcohol consumption in pregnant adolescents. This further is associated by low socioeconomic status, early onset of alcohol use, instability in marital relationship, and low adherence to parental consultation. It is crucial that females have prior knowledge to the implications and consequences of alcohol consumption during pregnancy. A limited education can inhibit an individual's awareness of the severity of alcohol consumption. Thus, females are unaware of support services and ways to approach a change in habits. For example, a study conducted by Philip Kavanagh surveyed 99 individuals, examining their knowledge on safe drinking practices during pregnancy and outcomes of children with FASD. Results revealed that education levels of females was a major predictor of knowledge of safe drinking consumption during pregnancy and knowledge of outcomes for children with FASD. Social support can either reduce or increase alcohol use in women who are pregnant. This depends on the behavior and support of friends, partners, neighbors, or even co-workers. It has been revealed that pregnant women continued alcohol consumption in conjunction with family members, thus suggesting the importance of a strong social support network. There is lack of support for individuals who are seeking help when they are influenced by a negative and poor social support group. Furthermore, this highlights how important support groups are in eliminating or minimizing alcohol-induced pregnancies. What are brief alcohol intervention groups? These groups provide cheap screenings and assessments for individuals dealing with alcohol-related problems. these groups are extremely beneficial for pregnant women as they can ask for professional help about any questions about consuming alcohol during pregnancy and ways to reduce the harm related to the risk. 250 participants participated in a randomized clinical trial. They underwent a comprehensive assessment of alcohol use, or an assessment with brief intervention. 99% of the 250 subjects returned for a follow-up assessment. It was uncovered that 43% of mothers drank alcohol within the first 6 months of pregnancy. Of those subjects, only 17% of them showed an increase in alcohol consumption after the second brief alcohol intervention group visit, thus showing the importance and successfulness of brief alcohol intervention groups. According to the National Alcohol Strategy, creating a tax on alcohol, minimizing the availability of alcohol, and bans of advertising greatly minimize harmful alcohol use in Australia. In 2015, Australia was ranked in the top third of countries for taxation on alcohol beverages. The implementation of these techniques makes it difficult for individuals to purchase and consume larger quantities of alcohol, thus leading to the minimized alcohol consumption for pregnant women. Although the idea of an alcohol tax may only affect lower-income individuals, whereas higher-income earners can still afford the purchase of alcohol at increased prices. Thus, the combination of techniques will widely minimize alcohol consumption not only for pregnant women, but for the wider population.